Okay, so we're live now. Over to you, Malaika.
Thank you. Good evening, everyone, and Assalamu alaikum. My name is Malaika Osman, and I'm a third-year MBBS student here at Khabar Medical College, Peshawar. It's an absolute pleasure to be your moderator for today. On behalf of the Student Research Committee, I'd like to warmly welcome you all to the final session of Foundations of Research, a 6-part webinar series that has been a journey of learning, discovery, and research growth. This series continues SRC's legacy of promoting research and academic excellence. Recordings for all the previous sessions have been shared with participants, and the sessions were also live streamed on YouTube, making them freely accessible to anyone around the world. This achievement has only been made possible thanks to the tireless efforts of the SRC cabinet, who worked relentlessly to ensure everything ran smoothly. A huge shout out to Team Academics, Team Media, Team Activities, and of course our President Sundar Soma, along with our dedicated faculty. Our final webinar today is on writing manuscripts and publishing them in credible journals, one of the most important and often intimidating steps in the research process. We are delighted to announce that Dr. Jahan has also joined us for the session. Dr. Jahan currently serves as the chairperson SRC, and it is truly an honor to have you here with us, sir. Sir, if you would like to share a few words with the students. Dr. Jahan.
Assalamu alaikum. Indeed, it's an honor for me to be your chairperson of such talented students, mashallah. And today is our last session of the webinars, and I'm extremely happy to see Asad Rehman Khattak. We had very good memories and good work with each other. He's one of the pioneers of Student Research Committee. He did a lot of work in initial stages, and now Alhamdulillah, SRC is doing great. I am constant in SRC, but the students are changing. So today's session is extremely important. In initial webinars, we learned different subparts of an article, in synopsis writing and stuff like that, starting from how to select a topic. So in today's session, I hope that will be not long enough. Asad will cut it short and simple because students don't like long, lengthy lectures, webinars, workshops, and stuff like that. So I will be also listening keenly and will be there to answer any questions or any support. Thank you so much.
Thank you, sir, for your valuable insights. Your support and encouragement are invaluable to us, and we deeply appreciate your presence today. We are also honored to have Dr. Sadia with us. Dr. Sadia, if you would like to share a few words with us. Moving on, I am especially honored to welcome our speaker for the session, Dr. Asad Rehman Khattak, a proud KMC alumnus and a former SRC president in his final year. Dr. Asad, thank you for taking the time to join us today. We are truly fortunate to have you here with us. Before we begin, just a few housekeeping announcements to help this session run smoothly. We strive to maintain a respectful and polite environment. Please be courteous and professional in your interactions. A stable internet connection and preferably a laptop or desktop will help you have the best possible experience. Our team will keep your microphone muted when listening to the session to minimize background noise. Questions for the speaker can be submitted through the feedback form, which will be shared at the end of the session. If you face any technical difficulties, feel free to direct message me in the chat. Please join with your full name so we can register your attendance properly. This session is being live streamed on YouTube and recorded for future reference. By participating, you consent to being recorded. A feedback form will be shared at the end, and we highly encourage you to fill it out. Your feedback helps us grow. Questions for the speaker can be submitted through the feedback form. Now, without further delay, it is my distinct privilege to introduce our esteemed speaker for today, Dr. Asad Rehman Khattak. Dr. Asad is currently a first-year trainee in surgery at the Medical Teaching Institution, Hayatabad Medical Complex, Peshawar. A proud graduate of Khabar Medical College class of 2023, he also holds a certificate in health professional education. During his final year of medical school, he served as the president of the Student Research Committee, a role in which he demonstrated exceptional leadership and a deep commitment to advancing academic culture. With 2 publications to his name as well as 3 clinical audits, Dr. Asad's work reflects his dedications to evidence-based medicine and quality improvement. Before commencing his surgical training, he served as a lecturer in pathology at Rehman Medical College. Dr. Asad has guided numerous students in their research journeys, and his skill in simplifying academic writing makes today's session especially valuable. Dr. Asad, we are honored to have you here with us. The floor is yours.
Assalamu alaikum and good afternoon, everyone. It is truly an honor for me to be invited as a speaker for this webinar series. My sincere appreciation goes to the SRC team for organizing such a successful and well-executed event, a remarkable feat that speaks volumes about their dedication and vision. A personal note to Dr. Jahan, we do have fond memories, and thank you for such kind words. It's truly heartwarming to hear from you. And I hope that we can be in collaborations far into the future, inshallah. I would also like to thank Ms. Malaika for the kind introduction and for the whole team for having me today. I'm genuinely happy to be here and even more delighted to see and hear from such brilliant individuals and contributing to this inspiring platform. So without further ado, we will commence the presentation. So I'm just gonna quickly share my screen. Okay. Malaika, am I audible and is my presentation visible to you? Can you please confirm?
Yes, you're audible, and your presentation is also visible.
Okay, so a little before I begin, if I'm nervous, I do apologize, and I do hope that I do not bore you through the process. If I do bore you, I guess the silver lining is you can have a nice afternoon nap afterwards. My topic for today is manuscript writing using AI ethically, referencing and understanding submission platforms. I would like to point out that it is quite a content-heavy topic, but I will do my best to touch on each area individually without extending the presentation beyond the 1 hour mark. So again, without further ado, let's get started. Before I begin, a little disclaimer. I'd like to make a quick disclaimer that this session is purely for educational purposes. Any tools or websites that I mention are for illustration purposes only. They are not endorsements, and I have no conflicts of interest to declare. So the learning objectives for today's session are that by the end of this session, the participants will be able to describe the basic structure and components of a medical manuscript using the IMRAD format, apply ethical principles in using AI tools for academic writing, demonstrate the correct use of referencing styles commonly used in medical research, identify key steps in navigating journal submission platforms. So a little recap of what we have learned so far. So we touched base with the introduction to research and the importance of research, why it is important for students to be part of the medical research projects. We also spoke a little bit about topic selection, writing research proposals, how to collect data, then data entry, and then finally analysis as well, which brings us to our topic today, which is manuscript writing. So what is a manuscript? So basically, a manuscript is a medical research document. It is a formal structured document that presents methods, results, and conclusions of a medical study for publication in a scientific journal. So a few types of the commonly encountered medical manuscripts are original research. So what an original research is it basically represents studies where you collect and analyze your own data to answer a specific question. For example, a cross-sectional study assessing the prevalence of hypertension among adults in Peshawar. So most of our discussions will be oriented around original research. Then another example is case reports. Case reports basically describe unique or rare clinical cases that help clinicians recognize or manage similar situations. For example, reporting a rare complication of a known disease, or if you're in your clinical practice, you encountered a rare genetic disorder. So it sort of basically it brings it to everybody's attention that you discovered something new, and then maybe somewhere else in the world they see something similar, and then they can get guidance from what you've written and documented. Then we have reviews. Reviews are basically, they summarize and analyze existing research on a specific topic. There are multiple kinds of reviews. They can be author-guided summaries, they could be systematic, and then the one that is very frequently talked about, meta-analysis. So they all count as reviews. Then there are letter to the editor. So letter to the editors are basically, letters to the editor are basically short pieces addressing recently published articles or presenting brief findings. So it's basically something that you read and then you encountered in your clinical practice or wherever, and then you basically write to sort of add to the information of the article itself. So if it is about a disease and then you saw something that you found that was not mentioned, or you want to add to it, or you feel like you can contribute to it, then those are basically that type is basically letters to the editor. So moving on, a little bit about the structure of each. So original research, it follows the IRD format. We'll be talking about that extensively in the future slides. So it basically has an abstract, introduction, methods, results, discussion, conclusions, and references. These are usually they are in subsections. Case reports have an abstract, introduction, a case description, discussion, and then references. Reviews have an abstract, introduction, thematic sections, usually organized by topics or chronology, discussions and conclusions and references. Letters to the editor usually do not have an abstract. They're short. It has an introduction, comment, and conclusion with a few references. So moving on, structure of a manuscript. Like I previously brought to your attention, that we will mainly be focusing on the manuscript of an original research study, which forms the foundation of writing other kinds of manuscripts. So if you know how to write the manuscript of an original research study, you should be able to apply the same principles to all kinds of related medical research manuscripts. So we'll be primarily focusing on that and hopefully make the foundational principles that are required for manuscript writing. So the components of a manuscript are a title, an abstract, keywords, introduction. IMRAD basically stands for introduction, methods, results, and discussion. And then at the end, we have references. So what is a title? So a title is basically, well, we all know what a title is basically, but how do you form a title? So a title consists of concise, clear, informative words, and it reflects the main study of the main focus of your study, basically. So it should be reflective of what you've done. right? Then we have the keywords. Keywords are 3 to 6 relevant terms. It improves indexing discoverability. We usually use the word mesh words, so mesh headings. So mesh headings are basically medical subject headings for biomedical, terms for biomedical papers. Some of the tools that we use are mesh browsers, PubMed. I'll briefly discuss them as we go further along. And then an abstract is a brief summary, structured background methods, results, conclusion, or it could be unstructured. Unstructured should stand alone and convey the essence of your work. So here I've mentioned that we should avoid jargon if possible. So what is a jargon? A jargon is basically a specialized technical term that is mainly understood by specialists only. So we should hopefully, and we should try to avoid overly specialized terms in the title, because what that does is, if it is very specialized and not everybody knows it, it sort of, it hinders your discoverability. So not a lot of people can then read about your article and find it, right? Then we have, let me give you an example of using a medical jargon. So for example, there is a surgical study that says comparative analysis of laparoscopic versus open pancreatic or duodenectomy in the management of periampullary neoplasms. So it's very unlikely that somebody who is interested in something like that, that they will have the right words to search those exact words. So that will limit your discoverability if you use jargon. A better example would be comparison of keyhole surgery and open surgery for tumors near the ampulla of Vater. So we have to find the right balance between using mesh words and avoiding jargon. So mesh words are basically standardized terms used in PubMed usually to improve searchability. How do you find mesh words? I've mentioned tools, Mesh Browser and PubMed. I generally usually rely on PubMed, and it's very simple. You just go to PubMed. They have a subsection that reads mesh database. You just type in whatever you want to type in, and then it gives you. So a few examples about jargon and mesh headings, so that we can sort of find the right balance in what words to add in our title. So for example, heart attack. So if you want to talk about heart attack, the jargon would be acute coronary thrombosis with ST elevation and myocardial necrosis. And then the mesh word would be simply myocardial infarction. Everybody who is in the medical field and beyond knows what myocardial infarction is. So moving on, we have an abstract basically. Let me actually give you another example as well. So if we're talking about stroke, the jargon for stroke would be acute thromboembolic cerebrovascular accident, and then the mesh word would simply be stroke. So the way this works is you type in your the thing that you want to talk about in the mesh headings, and then it kind of gives you an examples, and it gives you a list of words that are related to that heading, and then those words can be used in the keywords. I hope I'm making sense. So moving on to the abstract. Abstract are, they're basically just written usually at the end. So the way I describe an abstract to anybody is basically the movie, the trailer of a movie. So it kind of gives you a rough idea of what is going on in the research, and that helps the reader to get interested in the article, and it sort of begs them to actually read the whole article. So the abstract, if you have been part of the whole research from the start to the end, you know what goes in the abstract, because you know what is important, you know what stood out to you, and then you add that in the abstract. So moving on, we will talk about the introduction. So I'll be going back and forth. I've made a dummy article basically, and in that we will be sort of going up and about what actually goes into a manuscript. So this is basically a very short version of what a manuscript should look like. And after this, I will also show you what an actual manuscript for a published article looks like. So we'll focus on the dummy article for now. So the title goes here. So prevalence of sleep disturbances among MBBS students in XYZ Medical College. The authors go here, and then we have an abstract, right? So an abstract is basically just a small trailer of what is to follow. So it just has the key findings, key methods that you've used, an introduction, maybe a definition of the problem, maybe your rationale, whatever. There's no one right way to do it. It comes with experience, and you know what to add and what not to add. You don't want to make it too long. And usually the journals that you want to publish in, they usually tell you how many words your abstract should be. So you just follow their guidelines, and then you have an abstract ready. But like I said before, it comes after you have completed your research article. Then we have introduction. So let's go back to my presentation. So introduction, the way I kind of explain an introduction is basically, why did we start? So it's telling the reader what made me start the research study, what made me put all this effort into finding something, right? Because it is a very tedious process. And so you have to convince the reader that whatever effort I put in, it was worth it. So it starts here. So basically, introduction is asking the question and answering the question, why did we start? So it basically provides a context and a background. So usually we begin by defining the topic at hand. So for example, if it is diabetes, we define what diabetes is. If we are talking about diabetes, the context would be how prevalent diabetes is in the world, how prevalent diabetes is in my setting that I have done my research in. So if it is hypertension, same, defining it, giving the background. If it is something specific, if it is surgical, then the same context, sort of concepts apply. So defining it and then also explaining the context and the background, right? So we have to explain why it matters. Another example would be breast cancer remains one of the leading causes of cancer-related deaths among women worldwide. So that would be another sort of background and context to an introduction. Then we have to identify the knowledge gap. So knowledge gap basically is, why am I, like I said, why am I going through all this effort? What am I addressing? So knowledge gap is if there is a thing, a concept that has been tested abroad, but it has not been tested in where you work. So you want to bring that and test it here. So that would be a knowledge gap. If there are new studies or there's a new concept. So these days, a lot of people are talking about AI integration, this and that. So, and then going back, COVID came in. So we did not understand much about COVID. So let's say we did not know what the prognostic factors in COVID were. So that was a knowledge gap, which we identified. We wanted to know, when a person who tests positive for COVID, what tests can I do that tells me what their clinical outcome would be? So that would be a knowledge gap. So you need to identify the knowledge gaps for your study, right? Then we need to know the aim and rationale. Usually I find this very difficult because rationale, there is so much literature available that it is so difficult for you to justify why you are using. For example, if you're taking means, you're taking time, you're taking permission, you need consents from the patients and everyone. So you need to find the right reason to go through all of this. Sometimes research articles, as an author, you will ask people to give you funding as well. So if you do not have a clear rationale, if you do not have a relevant rationale, then it becomes very difficult to sort of sell your idea. So rationale is important. So it basically states the intent of the study. An example of a rationale would be, and I quote, "This study aims to assess whether early genetic counseling influences treatment choices in newly diagnosed breast cancer patients." So that would be a rationale for a study, right? And then objectives. So study objectives need to be SMART objectives. You can Google what SMART objectives are. And then we need to list sort of very specific objectives for the study. We need to keep it close-ended, and we need to have measurable goals. So for example, the percentage of people who change treatment plans after counseling, and something similar. So this is basically what an introduction consists of. So let's see what the dummy article says. So introduction. Medical students often face significant academic and emotional stress, which may adversely affect their sleep quality. So this is a nice sort of context and background. Inadequate sleep has been shown to impair cognitive performance, reduce attention span, and contribute to mental health issues such as anxiety, depression. Several international studies have reported high rates of sleep disturbances among medical students. However, there is limited data from our region. So this is identifying a knowledge gap. Then the rationale and sort of the objective as well, which is this study aims to assess the prevalence of sleep disturbances among MBBS students at XYZ Medical College and identify year-wise differences in sleep quality. So that is all about introduction. Like I said, this is just a dummy article, so it is a small representation of something good. Then coming back to my presentation. So then methods. First, we said, why did we start? Now, how did we do it? So methods should explain exactly how the study was conducted so others can replicate it, right? So you should have details about the participants that you used that were part of the study, materials that you used, procedures that were made use of, data collection techniques, statistical analysis, and it may include subsections. So materials are basically tools and instruments. For example, if we're talking about diabetes. So if you used a specific glucometer, you should use that. If you had patients that you had nil by mouth for a specific amount of time, you should use that and you should claim that, right? And then procedures, like I said, if you said that like, for example, if before you measured the glucose levels, you had the patients go through, not patients, subjects basically, go through an 8-hour fast. So you mentioned that as well. And then data collection, basically, if there's a specific questionnaire that you use, so you mentioned that you use these questionnaires, you use these tools, right? And then statistics, so if you used SPSS volume 23, for example, so you mentioned that as well. And you also mentioned any specific tests that you use. So for example, if I used chi-square for categorical variables, if I used a Kolmogorov test or any other sort of test, so I will mention them in my methods section as well, right? So the whole point of your methods is to replicate. As researchers, the whole concept is that we do not gatekeep. Our entire motive is to add to the literature, to add to the existing knowledge, to play our part in progressing the medical world, to progressing the medical knowledge that is available. So we do not gatekeep. If I've done something that I feel like could help somebody else, I will declare it and I will disclose it, right? So the whole point is for replication. So it should be so clear that whoever is reading it should know exactly what to do. So if, for example, I use the specific tests in Peshawar and somebody in Karachi wants to do the same thing there, they will know exactly what to do and they will know how to improve it, right? So that is the whole point of methods. Then we have results. So results is, actually, let's go back to the article. I'm sorry if this is, nope, sorry, this is annoying. So methods. So for example, this was a descriptive cross-section study conducted here, 150 MBBS students, blah, blah, blah. Then the type of questionnaire you used, so Pittsburgh Sleep Quality Index was used. Then the questionnaire was administered online via Google Form. SPSS was used. The descriptive statistics were presented as percentages. Then any tests, so we used the chi-square test, right? And then ethical approval mentioned as well. So that is basically a little glimpse of the methods section of a manuscript. Coming back to the presentation, then discussion. So discussion is basically, and one thing that I did not mention in the results is you do not basically tell the implication of your result. You just kind of document what you found, right? What it means is left for the discussion section. So basically, you only focus on your discoveries and save the interpretation for discussion. So mention the discoveries, don't talk about the interpretation. Right, so then discussion. So now we come to the interpretation. What does it mean? All the effort that I put in, all the results that I gathered, all the statistical analysis that I do, where does it fit in with the rest of the world? We compare and contrast with other studies that are there already in the literature. And then we also sort of talk about some of our strengths, some of our limitations, implications, and future directions, right? And then the last section could be used for the conclusion. So in a bit more detail, for discussion section, we interpret the results and offer explanations for what we observed. For example, greater HbA1c reduction may be due to improved adherence from regular counseling. We also compare with existing literature. We either agree, we disagree, or we add a nuance to existing literature. So for example, you can say consistent with a study performed by XYZ in Karachi, or we can say that similar to the studies or different from studies, or we can just share our findings and we can say that this was same as it was reported in Japan, for example, or it is different from what was reported in Turkey, for example. So this is where you sort of kind of take what you've done and fit it with the whole realm of information that is present, right? Then you talk about your strength. So for example, if you used a randomized controlled trial. So you can say that a randomized control design reduces selection bias. So you can mention that you reduce selection bias by following this technique. Then you can talk about your limitations. For example, if you did it under one setting, if it was just one institution. So you can say that single center study may limit external generalizability. So that would be a very important limitation to your study. And you don't shy away from your limitations. You wear it like armor, because then that tells the reader that you were aware of your limitation. You were aware of what you were doing. So limitations oftentimes, especially in our part of the world, we are very shy from disclosing our limitations, but it is the opposite in the research world. You need to tell them, because then that gives the impression that you are confident in what you've done. And then that also kind of changes in a positive direction in a way that your results would be interpreted very fairly and accurately, right? And then future directions are also very important, because future directions suggest next steps. So for example, if I did it in one study, my future direction, my sort of advice to the audience, to the reader would be, maybe if you're replicating the study, maybe consider doing it in multiple settings. So then that sort of, again, fits in with all the research that is available. And it also improves the knowledge that is already present. And then the final paragraph usually can be used as a conclusion. So whatever you concluded in your study, if you said that genetic counseling improves the HbA1c, dietary counseling improves HbA1c levels or whatever. If you found that, you add it to your discussion section. So let's go back to the dummy article. Whoops, I keep going back to Google, my apologies. Results, we spoke about results. So results is basically the percentages that you found, right? Any statistically significant results that you have, you want to point out. Even if they're not statistically significant, you should still point them out. So then you have tables and charts that you can use in your results section as well. Discussion, now that we just discussed, discussion, for example, the findings of this demonstrate a high prevalence of sleep differences among MBA students. This aligns with existing literature, which shows that sleep quality tends to deteriorate with increasing possibilities. So it sort of compares and contrasts, right? And then let's see, the use of validated tool like PSQS strengthens the credibility of these findings. So this is my strength. However, the study has limitations, including reliance on self-reported data and its confinement to a single institution. So these are my limitations, and these are future directions for further study. Future studies should consider longitudinal approach and effectiveness of interventions such as social wellness programs and sleep hygiene education. Then you have your conclusion. Issue about targeted interventions is essential to improve both academic performance, overall well-being of medical students. So that basically concludes your manuscript, and then you have your references as well. We'll talk briefly about references as well. So coming back to our presentation, so you kind of saw what the dummy article looked like. So we'll see what an actual article that is published looks like. So this is one of the articles that I was part of back in final year, I think. So you have your title, you have your authors, then you have the abstract, right? So you have your abstract. It's a very small sort of trailer of what has gone on in the study. You have your keywords. So keywords, like I said, it improves your discoverability. So if I used asthenopia or accommodation, so or visual acuity, right? So anybody who looks for visual acuity, this article will be part of it. And when and once you've kind of published an article, you want more and more people to read it. You want more and more people to cite it, because that improves your credibility as an author, right? So you have to be very, very well versed with these mesh terms, and you need to know what to use and what not to use, right? So then we have the introduction. You have the results kind of here. We used a table to talk about all the results. Then we also describe the results, right? Here you have your methods. I apologize for the weird sort of alignment, but yeah. So then the methods, all the things that you used: digital eye strain, symptoms associated with refractive errors. Then you come to the results. So it is basically the description of all the tables that you used. And let's go back to the method. So for example, if we used a specific sort of sample size calculator, so we kind of declared that, right? Ethical approval, we declared that as well. So then you come towards the results. It is basically a description of everything you found. Then you come towards this discussion. It is basically the interpretation of your results. Discussion tends to be the longest part of your manuscript. So you have to be very, very well educated in the topic. You need to know what is going on in the topic in the rest of the world for you to sort of write a very good discussion. Then you have your conclusion. Like I said, conclusion can be part of the end of your discussion as well. Then you have your references. We'll speak briefly about the references as well. So here we used about 26 references, right? So now that we're done with this, let's go back to our presentation. So references. What is the importance of referencing? So referencing is very important because it avoids plagiarism. I feel like by now we should all know what plagiarism is. And it also gives credit to the original authors and allows readers to trace the original sources. So if you claim something in your article, you should have so the way I describe referencing to people is that if, let's say, I define diabetes, right? I'm not the person who coined the term diabetes, neither am I the person who was the first person to discover diabetes. So I cannot take credit for diabetes, the word diabetes itself, or the definition of it. So I have to reference somebody who also used it, or the original person who coined the term. So wherever they coined the term, I will reference them. So I cannot take credit for something that I did not do. And in order to do that, you reference them, right? The only thing that you can take credit for is basically your results, your interpretation of the results, and also your conclusion. So those things usually do not require referencing. But other than that, everything that you read, all the articles that you've read, you have to reference them, right? So if a reader who's reading your article wants to find where you found that information, maybe they want to improve on it, so they can know where to look for those similar articles. And I find referencing very important personally as well, because sometimes if I'm part of a research study, if I'm doing my literature review for it, so I just open one article and I just go to their referencing list and I just click on their links. And that is how I discover more articles, more articles. So by the end of it, within an hour, I have like 20, 30 articles on a very relevant topic, only because they referenced it well. So that's why referencing is important. And I just mentioned referencing comes towards the end of your manuscript. So referencing style, we have Vancouver. It is commonly used in medical papers. So whenever you're reading and you see like a superscript that is written on top of an article. So for example, you read something, there's a line, and on the top right corner, it has 2 or 3 written on it as a superscript. That is basically Vancouver style. Then we have APA and Harvard. They're similar, but they're not the same. So mainly we need to be acquainted with these, but with a few things that I will discuss in the few tools that I will discuss in the following slide, you don't really need to know exactly how to reference articles, because you have tools that do it for you. You just need to know which sort of referencing style to use. And how do you know that? You just read the journal's instruction for authors. If there is a specific type of referencing style that they want you to do, you would just do that, right? So this is a bit wordy sort of referencing example. So APA style, you have this whole thing. So you have the author's last name, right? Initials, so Smith, J.A. separated by commas, year in parentheses here. Then you have the articles, sentence case, only first word, proper nouns capitalized, right? So Journal of Clinical Health Research. Then you have the journal, which is italicized. It is in italics, basically. Then you have the title case, volume, parentheses, not. Then you have the pages, and then you have the DOI. What is a DOI? DOI is basically it's called Digital Object Identifier, I believe. And what that does is, so for example, if it's very important these days to have a DOI. So for example, if I published an article in Khyber Medical College's journal, and tomorrow the government changed and they decided to change the name of the institution, so they would change the name. So it would not be called Khyber Medical College Journal anymore. But still, if I have this link with me, no matter what they do with the URL, no matter what name changes they go through, as long as I have this DOI link with me, I will always be able to source that article online. So it is very important to know which journals kind of give you a DOI. And it is always good to keep a track of your DOI, because it's basically like a social security number. It helps you track an individual or whatever, even if they have moved houses or whatever. So it's basically a way to trace articles, and it is a very foolproof way to look at articles. So even if you published an article 10 years ago, that journal is nowhere to be found. You can use DOI to find that, right? Then Vancouver style, don't want to go too much into the detail, because honestly, you need to know what is going on, but you don't really need to know the exact specifics, because I don't think you will ever find yourself in a position where you will have to sort of manually write the whole referencing. So you just use the following. And one of the reasons I sort of added these is to just show you how, kind of point out how they're a little bit different. So like there the title was, it was in sentencing, a sentence case, only first word and proper nouns capitalized. Here the title was only first word and proper nouns capitalized, and the journal title was abbreviated per PubMed style. So it's sort of, there's very small differences in the way they look in the referencing section, and also the way they look in the reading section, the manuscript section. They look a bit different, but still You just need to know what the article wants from you, and you use the following tools to generate the references for you. So common tools used for referencing is basically Mendeley, Zotero, EndNote. Before I proceed, if I'm boring you, if this is very monotonous, I do apologize, because all I'm doing is just looking at a screen, and this is very new to me. So if I'm being boring, I do apologize. Sit tight, we'll be done soon. So moving on, common tools used for referencing, basically you can use Mendeley. Mendeley is a free referencing manager. It helps you store, organize, cite, and annotate PDFs. So if you have a pen and paper with you, I think it would be worth noting down these names with you. Zotero, I've used Zotero so far because I find it the most easy to use. It's basically an extension. It helps you create a library, and it helps you to cite all of them. So the way I use Zotero is, if I like an article and I want to read it, I'll just put it on Zotero. It will add it to my my library. And then if it is on number 10, and if I found that helpful, I'll just tell the app that I found this helpful, and I will reword it. I would type it down, and that will do the referencing for me. So Zotero. But Mendeley is much more advanced, and if you want to learn it, I feel like Mendeley would help you much more. And you look good doing it. As a researcher, if you're using Mendeley, you look good doing it. Then EndNote. EndNote is basically, I think it is, certain features of it are free. Certain features, more advanced features, are paid for. So if your institution has paid for EndNote, perfect, use it. EndNote is also very impressive. If you know how to use EndNote or Mendeley, it makes your life very easy. It's very easy to do. But again, you can use very simple things, like you can just manually, if you read an article, tell AI to reference it using a specific sort of referencing style, and it'll do it for you. And then you can just manually add. So if it is the third sentence, it is your third reference, you just manually add that it is your third, and you copy paste it. So there's multiple ways to do it, but common tools that will come in handy are these three. So then moving on to the use of AI. So we're done with the manuscript. If you have any questions, I hope you've written them down, and then towards the end, you should be able to get a feedback form, and then you can write down your questions, and I'll hopefully be able to answer them. So I hope you understood a manuscript, what a manuscript is, what are the components of a manuscript, what makes a manuscript good, relevant, all these things. So hopefully by now you kind of have an understanding of what a manuscript looks like and what goes into writing a manuscript. So now coming to AI, artificial intelligence. So the way I've divided it is in three subheadings. So the good, the risks, and then how to use it ethically. So let's talk about the good, right? So AI, like it says there, it helps in many ways, right? So AI tools can help in many ways, improving grammar and clarity, generating outlines, structuring drafts, and automating referencing formatting that we just discussed previously. All of these things save time. So things that you would take you weeks before. So when I was, say, in first year, second year, third year, when we would be doing these things, it would take us a tremendous amount of time. Oftentimes, people would just have students do the scut work for them just to save time. But now you can just do all of these things yourself because you have AI present. So AI does all these things with you and for you, right? It can help you with formatting. It saves time, like I said, and it helps you with editing as well. Some of the examples are ChatGPT, that we all know. Grammarly, it helps you improve grammar. Then you have Quillbot, which also kind of helps with grammar and writing manuscripts. Then you have Julius AI. So Julius AI, I recently discovered that it is excellent in helping with statistical analysis. So it helps you understand what tests to use, where to use them, and how to use them, and whether you've used them properly or not. So Julius AI is very important. So Again, if you have a pen and paper, I would advise you to at least write the names of these, and then you can just Google them and try to understand them in your own time. Elicit is also it's helpful. So elicit, consensus, and cite. These are more sort of medical research based. I personally do not have much experience with them. They were only recently brought to my attention. But what I know, that the little research that I did on them, I found them very helpful. I feel like they would help me in the future a lot. So these are some things that I would be looking into as well, as part of my training and everything. Because when you have AI, it sort of kind of helps you see things that you normally would not see as well. So I would make note of Julius and elicit, consensus, and cite. So make sure that in your own time, you sort of read about them and understand what goes into it, right? Then you have the risks of AI, right? So even though it has a tremendous amounts of benefits, artificial intelligence, but there are still some risks that come with it. Nothing in this world is perfect. So by default, AI is not perfect. So it does come with risks. That does not mean that you sort of abandon it as a whole, but you just need to be wary of what the risks are and how to mitigate them and how to know the risks and proceed accordingly. Right. So again, plagiarism, loss of originality, patient confidentiality risks. This is very important. So we talk about confidentiality, we talk about not disclosing the identity of patients. Oftentimes, I'm sure as part of this webinar series, it was spoken about as well. So confidentiality risks is very important because you never know where the information is going. So if I did a specific test on Asad, who consented to the study only because his identity would not be disclosed. So you need to be careful to not even tell AI of their identity as well. Right. Then we have fake or inaccurate references. So sometimes AI can generate references or DOIs that do not exist. It's just a known glitch of AI. So it's called AI hallucinations. Over reliance. This is a very big problem, especially in our part of the world, because I remember when I used to teach and I would give my students kind of a task to do. All they would do is just type it in, get it, and show it to me with no originality, no understanding of what is going on, whatever. So that kind of it, and it's very like, if you're a bit well versed, it is very see-through. When you have AI generate something for you and you have not put an effort into understanding what has gone into it or what is written, it is very easy to see that AI generated this and you had nothing to do with it. So it weakens critical thinking. So like I said, AI is it helps, but it does have risks with it, right? So that brings us to the next topic, the next point, which is submitting without verification is unethical and dangerous, because you never know what AI has told you. Maybe even the artificial intelligence is telling you to fact check it. Sometimes there are websites that are blacklisted or that are known for having information that is not factually accurate. So if AI used that website and you did not go through the process of verifying it, you are in worlds of trouble now because you have put in something that is not factually accurate, and that makes it not only ethical but unethical, but that also makes it very dangerous. So you have to be very careful, right? Then you have the concept of improperly trained AI models. They can generate bias and unreliable results. So an example would be, you have a lot of universities these days that are training AI models, especially in the field of radiology these days, for example. So you just upload a chest X-ray and it will tell you all the findings. You upload an ECG, for example, it tells you all the findings. So these are basically trained models. It helps you see things that you might miss. But the thing with these models is that they are kind of prone to a bias. One of the ways, let me just think of one way that it might generate a bias. So for example, there is a study that tells you that was done primarily on adults, for example, and you want to apply that on your phone on a child. So I hope you see where the bias comes from. So it will tell you the treatment for an adult. It will not tell you the treatment for the child. And you might actually apply the same, for example, the adult dose for ciprofloxacin, right? For a specific sort of disease. And AI was trained based on adults. And now you have a child that presents with that disease, and you just type in the information and it tells you the doses. That dose would apply to the adult, but not the child. So you have, they tend to have a bias. So I hope that made sense, that sometimes improperly trained AI models can generate bias and unreliable results. And I gave you an example of a child. Then also, for example, studies done predominantly or genetic males that you cannot entirely apply on genetic females. So these are things that biological females and biological males. So these are things that you need to be very careful of. Then you have, let me see, I hope I didn't miss anything. Okay, so ethical use of AI. So what is allowed? Grammar checks are allowed. You can upload a sentence. You can ask it to reword it for you, rephrase it for you, make it grammatically accurate. Structuring drafts, idea generation, you can run ideas by them, right? But always, always, always verify facts and references. I just told you about the websites that they may use, and I also told you about improperly trained AI models. Avoid submitting work without human review. We end up embarrassing ourselves when we copy paste from ChatGPT. Please do not do that. Oftentimes, we just type in something to ChatGPT. In our head, we think we've provided enough information to them, but that is a model that did not see the whole thing. So sometimes you type it in, you copy, you paste it without reading it, and then 10 minutes later, you're like, oh my days, what did I just do? So always, always go through the trouble of a human review. Just read it once before you submit it. Then as far as medical journals go, AI is a tool, right? So just like any other tool that you would use, just like SPSS or EndNote, you should disclose AI assistance, especially if it is required by the journal or institution. So if you used it for manuscript writing, disclose it. If you used it for anything, if you used it for statistical analysis, make sure you disclose it, right? Because this will help your credibility as a journal. And then also, it's kind of a safety net as well. So for example, if the model was biased and I used it, and now 3-4 years down the line, that data comes out to be inaccurate, I disclose that I use that AI model. So I kind of have a safety net to sort of protect myself. So always, always use disclose AI assistance, just like you would disclose anything else. And also, it brings me back to the point that as researchers, we do not gatekeep. So if you are well versed with, let's say, Julius AI, and you used it for specific things, make it available to everybody. Everybody should know about it. Whoever's reading it should know about it, right? Then we have using ethically secured, de-identified data. Like I said, I mentioned the problem of the confidentiality. So de-identified data. Don't give them names. Don't give them information that can be very specific to an individual. Hints that a person can read and know that, okay, this is the person that we were talking about. So try not to give the data that you have as a researcher have a consent, but as a researcher also have a duty to protect your subjects or the people that were part of the study. So use ethically sourced, de-identified data, and always get approval from your institutional review board. So whatever journal, whatever university, whatever IRB board you have, make sure that they are on board, make sure that they follow. There's multiple principles. There's a Helsinki principle, and there's other principles as well that you can use for sort of the confidentiality issues. So use data as if AI is another person. So you have to protect the patient's confidentiality from AI as well, right? Again, declare AI tools used in methods or acknowledgement. Use AI as a helper, not a replacement. Um, one of the very interesting things that somebody once told me that I found very interesting was that he's very well versed. This individual in question is very well versed with AI. So I raised the question that, wouldn't AI just take over our jobs and everything, And he was like, you know what? No, we are looking at AI completely differently. The way I look at AI, and this is what he said, is AI is like a calculator. When the calculator was invented, mathematicians did not go out of business. Mathematicians became better. So AI is basically a tool. It is basically a helper. It helps you become better at whatever you're doing. So AI is a helper. It is not a replacement. Think of it as a calculator, right? So there's that. We spoke about the good of AI. We spoke about the risks. We spoke about the best practices using AI, right? And hopefully you'll find these facts helpful as you go along your research journeys. That brings us to our final topic. We're almost there, guys. Submission platforms. So this is kind of a text-heavy slide, and I do apologize for it, but I'll try to put in sentences here and there to make it make sense. So before I go in, obviously this looks very daunting and it looks very confusing, but let me just tell you, submission platforms are basically the journal does it for you, to be very honest. All you need to do is go to the journal, and when you are submitting your manuscript, they will redirect you, right? So even though we'll be reading these, you don't have to overfixate on all these sort of details of each of them. So let's see, editorial manager. So editorial manager is a widely used online manuscript submission and peer review system used by many publishers. Elsevier, Springer allows authors to track manuscript process. So it's basically, for example, you are ordering something online. So you place an order with a specific website, but then once they've packaged it, they redirect you to a courier sort of company. And then they give you a tracking ID and whatever, and you just take it up with them. So if you did not get it on time, you sort of talk to them about it. So what I'm trying to say is these are things that are used by journals to specifically focus on the publication process, right? And you do not have to go through them individually. Every journal sort of has it. Scholar One is another example, frequently used. And then sometimes journals have their own portals, right? So submission systems hosted directly on a specific journal's website. It is simpler, often used by smaller or independent journals. Authors submit via a journal's own platform. Here's a very important tip. Always read the journal's instruction for authors, since even within these systems, submission requirements differ. So before you even think about submitting your own manuscript, you should always read the whole instruction for authors, because it will give you information about what to do, what not to do, whether your article is relevant for that journal. You don't want an orthopedics sort of article being read in a cardiology journal. And if the topic at hand has nothing to do with cardiology, you do not want an ortho journal in cardiology, and vice versa. So these are things that you will find in the instructions for authors. And that is a very sort of important and extensive list that you should be very familiar with before you choose which journal you should submit to. A little more about journals. So how do we find the right journal for our manuscript? So I did my research, I did my literature review, I collected my data, I did everything, and I wrote my manuscript. So how do I sort of find it? One of the things that I find very helpful, you can just simply Google journal finders, and there are multiple things that will help you find the right journal for you. But the one that I personally find helpful is Elsevier's journal finder. All you need to do is just go to their website, right? They have a journal finder. You click on it, you upload your abstract, and it gives you a list of journals that are relevant for that article that you can possibly publish your journal into, right? Another thing about journals is that journals can be open access. So the way open access journals work is you upload an article, and that is anybody can read it. And the way that happens is you pay a specific fee. If you pay that, then they will publish it, and they will make it accessible for everyone. They can also be closed access journals. Closed access journals basically require subscriptions. So you need to be a subscriber in order to read that journal. Then you have hybrid journals as well. So hybrid journals it is basically on the publisher's discretion. If I choose to pay the APC fee, I don't know what it stands for, I kind of forgot, but if you pay it, then they will make your journal accessible to everyone. And then that sort of widens your audience for your research paper. And if you do not pay it, then it is basically behind a paywall, so you have to pay to see it. So strategies to match the topic and aims of your research, basically to find your own. One of the strategies that I sometimes have used is I see where if I'm talking about, let's say, diabetes, I will look at other articles about diabetes and see where they were published. So it kind of gives me an idea of what sort of journals that I can publish in. We can also look at indexing, where similar papers were published. And like I said, you should always go read about the aims and scope of the journal as well. So you need to make sure that your scope, whatever you talked about is within the scope of that journal. So it's not a mismatch. It's not a very obvious mismatch, I'd rather say. Okay, another important thing for people in Pakistan is that we have a very good journal recognition system by the HEC. So they have an official list for Pakistani journals. They have categorized them according to multiple things. So you can see which journal is good, which journal is not good. They also flag dangerous journals for you as well. So HEC has a very good journal list, and it kind of gives you an idea of what journals you can go to. So if your paper is very good and you do not want to, and this is a very bad word, but a subpar journal, you do not want to settle for it. So you can use these sort of journal finders, even HEC journal finder, to sort of find the right journal for you, right? Some journals that we need to avoid are predatory journals. They basically charge money and they will publish your article in 48 hours. So if your article did not go through a very meticulous scrutiny process, stay away from that journal, because there's chances that that journal may be predatory. It just wants your money and it will just publish anything. So we want to stay away from them. We want to stay away from blacklisted journals, and we also want to stay from hijacked journals. One of the ways to do that is there's a concept of ISSN, International Standard Serial Number. So whatever journal I am considering, even if I am considering reading a specific article from it, I want to know that that journal is recognized. And one of the ways to do that is they have a specific ISS number, ISS number, International Standard Serial Number. So if it has that, it's kind of a safe bet that it's one of the good journals. And one of the ways to verify that is ISSN has its verification portal. So you just copy it, you paste it in that portal, and if it is registered there, then good, that's a green signal, go for it, right? So let's see what have we got after this. So submission workflow, I think this is the last slide. So I've gone through the whole process. I've written down my manuscript. I've double checked it. Everything is ready. Everything is ready for publication. So first, you found the right journal for yourself. You register with that journal, and you upload the manuscript. One of the things you need to keep in mind is you should never upload your article with multiple journals simultaneously. Once you upload it with one journal, you have to follow the whole process, publication or rejection. After it is rejected, only then can you go and find another journal for yourself, right? So you should not upload it in multiple journals, hoping that you will improve your chances of publication. You will be blacklisted, and no journal would want to do anything with you. So you register with the journal, you upload a manuscript, you check, you complete the author's checklist, you read very carefully the instruction for authors, and you complete the checklist. You submit it for peer review. What is peer review? Peer review is basically a bunch of specialists that review your paper, basically. So if it's a cardiology paper, you have experts in the field, experts cardiologists, experts in the field of research, statisticians, everything that will review your paper. And if there's something that they need addressed, they will tell you. So then they will tell you that these are their sort of whatever they found that didn't make sense or wasn't done right, or they think that could be done better. Then they send that to you, and then you respond in the form of revisions. So you respond to all those things in the form of revisions, and then you upload it. Sometimes this is a multi-step process. So they tell you a certain amount of things, you address them, then it goes to peer review again. Then again, they tell you a few things, and then it's back and forth. And then finally, it becomes accepted and there's publication. One of the things in peer review is once the paper goes to peer review, that is usually a good sign, because that means that it made through the first sort of selection process. Because oftentimes the journal just outright, there's a desk rejection, they see the article and they tell you that we're not interested. So, but if it goes through peer review, that's a good thing. You should not be scared of it. That means that the journal is actually interested in you and wants to put in the effort to correct the mistakes, rectify them, so that they may actually consider go through with the publication. So then we have acceptance and publication, and well, congratulations, you are an author. So that is the end of my presentation. Just a few more minutes. Please be patient with me. I know that I kind of went overboard. Actually, no, I think I did a pretty good job in keeping it within the 1 hour time limit that was set for me. So key takeaways: clear ethical writing is crucial. AI can assist, but must be used responsibly. Accurate referencing strengthens credibility. Understanding submission systems saves time. And before I end, about the Q&A session, like Ms. Malaika said at the beginning, that there will be a feedback form. You can just ask your questions there, and then they will be redirected towards me, and I'll try to answer them to the best of my knowledge through email, inshallah. I have a little ending note written here. Let's see what it says. So before I end, I want to sincerely thank all of you for your attention and participation today. I truly hope you learned a thing or two from this session, and that I didn't bore you in the process. Even if I did bore you, like I said, the silver lining is it's peak nap time. You can have a nice nap now. Then a special thanks to my moderator, Ms. Malaika, for her kind introduction and support throughout this process. And my sincere thank you to the entire SRC team for their hard work in making this series such a success. For the Q&A segment, please submit questions to the feedback form. I will try my best to reach out and answer them via email. Finally, it's been a pleasure speaking to such a nice audience, even though I can't see anyone. And thank you once again for having me and for listening to me. And I wish you all the very best in your future research journeys. Jazakallah khair.
My turn to say the exact same thing. Thank you everyone for joining us today. And of course, a massive thank you to Dr. Asad Khattak for an incredibly informative session. If you have any questions for our speaker, you can submit them in the feedback form provided. This brings us to the end of our webinar, and with it, the end of our research course, but hopefully it's just the beginning of your journey into academic writing and publishing. Please don't forget to fill out the feedback form. And once again, thank you for joining us. And we hope to see your names in academic journals very soon. Allah Hafiz, and have a fantastic day ahead. Thank you so much, Dr. Jahan, for your kind words.